right? Now we shall be talking about the next one, that is the adolescent reproductive and sexual health, that is the ARSH clinic, right? ARSH, right? So now let's talk about the ARSH, ARSH, that is the ARSH clinic or ARSH. ARSH means adolescent reproductive and sexual health. Okay, adolescent reproductive and sexual health, that is the what? That is the ARSH, right? Now if we talk about the ARSH over here, right, they are basically mainly focusing on the girls adolescents, so they are focusing on Kishori, right? So I'm writing so that you understand. Focus is on Kishori. Kishori means female adolescent. Kishori means female adolescent, so they are mainly focusing on the female adolescents over here, right? So strategy over here was to open the ARSH clinic. They wanted to open the ARSH clinic basically. ARSH means they, adolescent reproductive and the sexual health. So basically purpose was to, share, which is the, that's kind of a taboo in many places, right? Mainly in the rural areas. And mainly the girls will be suffering from those kind of things, and they will not be telling to anyone, basically their parents and all of these things, they will not be able to share. So basically to avoid these kind of things, we were introducing this ARSH clinics, okay, in many places. So initially over there, there was not a very good response, because this ARSH clinic was talking about the adolescent reproductive and the sexual health, right? Now later it got replaced by the other name, right? So later, because it didn't got good response from the public side over here, because the name itself was telling us about the adolescent reproductive and sexual health. So because of this name, right, the people might be, people took it on the wrong side, and because it was focusing on the female adolescent, the family was not much comfortable to send their child to these particularly ARSH clinics. So that's how they understood it, and then they have changed their name. They changed this name from the ARSH clinic to the AFHC. And what was AFHC now? So they have changed this name. They later on they changed their name to AFHC. And what was AFHC? AFHC was adolescent friendly, right? So they have just modified the name, adolescent friendly health clinic. And then this program became successful, right, by changing the program. So what was the program over here? Basically they opened the clinic, right, and they were providing the weekly iron folic acid supplementation to the women, because it is very, very important. And in the Anemia Mukt Bharat program also, we have talked about the iron and folic acid supplementation. I have talked about the beneficiaries over there, right, all of these things. And about the menstrual hygiene purpose, right, because a lot of problems are there, a lot of taboo are there regarding the menses and all of these things, about the cycles and all. So all of these things might be resolved through these clinics. So anyone female who is having these kind of problems and all, they might be sharing this, and they might be getting the solutions for that. So that is the purpose of opening these kind of clinics, right? So that is the thing. So here we were providing the other than that, we were providing the iron folic acid supplementation, right? So weekly iron folic acid supplementation were provided, right? It talks about the menstrual hygiene. It talks about the counseling, right? Talks about the counseling regarding the family planning and all of these things, regarding counseling regarding the family planning and the family life and all of those things, right? So that's what the purpose of this particularly Kishori program, right? Rashtriya Kishore Swasthya Karyakram I talked about, that was the adolescent, male adolescent, and here we are talking about the female adolescent, that is the ARSH clinic. That was the ARSH clinic that was later replaced by the adolescent friendly health clinic. And this might be asked, guys, that's why it becomes important in itself that AFHC, you should remember this, adolescent friendly health clinic. These are just the other name for the ARSH clinic, right? Okay, now we shall be talking about one more program over here, that is the IMNCI, right? IMNCI. What is IMNCI over here? That is the integrated management of neonatal and childhood illness, right? Neonatal and childhood illness, that is your IMNCI. Okay, so please do remember guys this one. So here basically IMNCI is talking about any frontline worker can help in training children, right? They are basically talking about any frontline worker, you know, it might be multi-purpose worker, it might be the ASHA worker, it might be the nurses, and obviously the doctor. It is the duty of the doctor to treat the child over there. So you know, any frontline worker. So they will be giving the training to everybody, right? They will be giving the training to ASHA and all of these things. So at their levels, whatever can be done, right? For an example, diarrhea might be treated by the ASHA worker only. Obviously we will be giving the training, right? So if we are talking about the bigger level, right, and we are lacking the resources, so obviously we need to do something, right? So doctors will not be able to treat so many of the people over there, right? So if some milder diseases are there, we will be training our workers, right? We might be giving the training to the ASHA worker and you know, the Anganwadi workers. We might be giving the training to multi-purpose worker, the nurses, and all of these things. So at the smaller level, they might be they might be tackling these kind of diseases by their own, right? And then if the problem is a bit higher, then obviously they can refer to the doctors and the much higher specialties over there, isn't it? So that's how, because we were lacking the resources, to strengthen our resources, right, and to reduce the mortality. We don't want that any kind of mortality is happening. If we talk about any kind of child is dying due to diarrhea, right, or due to some pneumonia, or due to some any other kind of disease which might be handled with not much difficulty, right? So that is the thing over there. So that's why we don't want these kind of deaths which are happening very easily, right? So to strengthen our resources, this program was launched over here. So any frontline worker will be getting the training, right? And that's how they will be helping in treating the child. So they can help in treating the child. They can help in treating child, right? Okay, so there was IMNCI booklet, guys. Here, you know what kind of disease I'm talking about. They might be treating the malaria, they might be treating the diarrhea, pneumonia, and all of these things. Will be obviously giving the training, and if they shall be treating it, then they might be treating it over there at the smaller level. And if some complication is there, obviously they can always refer this case to the higher authorities, right? Okay, so integrated case management process you can see over here, right? Here we are talking about the three things over here. So basically they need to look, they need to assess, and then they need to treat it accordingly, right? So you can see that one is the clinical danger signs. They need to identify the danger signs, they need to assess the main symptoms, and then they need to assess accordingly, right? So if you talk about the danger signs, convulsions are there, lethargic, if the child is lethargy, or the child is unconscious, inability to drink or breastfeed, or vomiting, these are the danger signs. In that case, she should be actually referring this, if the multi-purpose worker is seeing this patient, ASHA worker is seeing this patient, she will be referring this patient to the higher authorities, obviously, because the danger signs are present. If the danger signs are present, first of all, they need to identify. They should be capable enough to identify the danger sign, and that is the training, right? That they will be learning in the training programs, right? So that's why the regular trainings will be given to them, so that they will be able to recognize these kind of signs in the babies and children over there, right? For an example, if ASHA worker is visiting the newborn, I told you about the visits under the home-based newborn care program and the home-based care for the young child. If she is visiting and she is not able to identify the things, then what is the purpose of giving the visits to this particular child or to this particular newborn, right? We are actually providing the visits over there. We are introducing the visits over there for the ASHA worker, because we want to rule out. Because if some child is having the diarrhea and all, right, every time they should not take this child to the bigger hospital and all of these things. At a smaller level, these things should be handled. So that's why we are providing the training to the ASHA workers and the Anganwadi workers at the smaller level, so that they can handle these kind of things at their own levels. And if they are recognizing some danger signs, then obviously they will be referring these patients to children to the higher centers, right? So that is the purpose over here. So this is the IMCI program, guys. They will be looking for the danger signs, they will be looking for the main symptoms over here, and accordingly they will be giving the symptomatic treatment to them, right? Okay, so nutrition, immunization status, and potential feeding problems and all, they should be assessed very well. So check for other problems, like what is the case over here, right? So we have actually divided them. For example, we will be giving the red sign to those who will be needing the urgent referral. right? For example, the patient is having the danger signs, all of these things, the patient might be needing the urgent referral to the higher centers, right? So pre-referral treatment, advise parents refer the child, and all of these things will be coming under this one. Or if it is green, then we can say the home management over there, right? What happens is that, first of all, that if the child comes to the primary healthcare clinic, for example, if you are looking for some kind of comorbidities, complications, all of those things, obviously you will be referring this child to the higher center, right? So that is the thing. In the yellow thing, here the child might be managed at the OPD level only, right? So give oral drugs, treat local infection and all, advise and teach the mother how to take care of the child and all of these things, and follow up. We will be calling this family for the follow up over here. Counseling the care on how to give oral drugs, treat local infection and home, continue feeding, and the looking for the danger sign will be educating them about that. So this is about the urgent referral, OPD level management, and the home based care management. Obviously, if the green signs are there, right, we are seeing that this particular child can be managed now at home as well, then we'll be sending the home, that will be the green sign. If the child needs the attention, still attention for the doctor, then obviously the child will be under the red and the yellow category. Over there, the doctor will be treating them accordingly, right? Now we should be talking about the next program, that is the INAP. This is the Indian Newborn Action Plan. Indian Newborn Action Plan, look at the logo over here. This is the logo for the INAP, right? So here we are talking about that newborn health attention, right? It was launched in the June 2014. And here they are talking about the reducing neonatal mortality, right? Newborn mortality and the stillbirth over there. They want to reduce it, and they want to reduce it till the single digit by the 2030, right? They want to reduce it till single digit by the 2030, and principles are the equity, equality, integration, and accountability. So basically this program talks about the decreasing of the newborn mortality, and they want to decrease it till single digit by 2030, right? So that is the target for the INAP. Okay, now we shall be talking about the next scheme, that is the Suman scheme. So now let's talk about the Suman scheme, right? So now we shall be talking about Suman scheme, right? It's a very popular scheme, guys, and here we will be talking about that under this scheme several programs are integrated, right? So this is the logo for the Suman scheme, which you need to remember, which you must remember actually. So this is what is Suman scheme. This is actually the abbreviation for the Surakshit Matritva Ashvashan, right? Suman means Surakshit Matritva Ashvashan, and this is the mother who is holding a baby, as you can see over here. And according to the Suman scheme, right, which is a Surakshit Matritva Ashvashan, right? Here we shall be talking about some important points, right, which are important for our exams. Zero tolerance policy is there for the denial of services to the newborn woman. As a doctor, you can't deny any pregnant female or their child to give the treatment, right? It's your duty to provide the treatment to them, right? So zero tolerance policy is there. Then integration of all previous schemes like LaQshya, right? We'll be talking about the LaQshya, right? Don't worry about that. 100% maternal death reporting, 100% like maternal death, whatever maternal deaths are happening in the hospital, they must be reported to the government, right? Free checkup for the pregnant mother before or after the delivery, right? Any kind of ANC checkup or any kind of PNC checkup, antenatal care and the postnatal care, they will be provided free of cost. Free transport facilities for the pregnant woman to the health center, they will be provided under the Suman scheme only. Zero dose vaccination for them and for their child, okay, they will be provided under this scheme. Direct cash transfer under the various schemes will be provided. For example, I have talked about other kind of schemes also where the incentives has been provided to the mother, right? All of these things has been integrated under the Suman scheme over here. And please remember, there is a zero tolerance policy. Any doctor can't deny to give the treatment to the mothers and the newborn, right? Otherwise strict punishment might be given. Okay, then once we have talked about the Suman scheme, we shall be talking about the components of the Suman scheme, right? So now let's talk about the components of the Suman scheme, right? So if we talk about the components of the Suman scheme, guys, here like some basic services are given. For example, ambulance, right? Ambulance services will be given, and the female or the mother needs not to be charging anything for this particular thing, right? Then about the minimum 4 ANC, right? I have talked about that, how many antenatal visits should be there. According to WHO, these are 8 visits, but according to Government of India, there are 4 visits, right? Generally, we are talking about that minimum 4 visits should be taken by any mother, right, before the delivery. So minimum 4 ANC visits. This is also the component of the Suman scheme over here about the delivery mechanisms, right? This is also the part of this one, right? Fourth one is about the care with dignity, right? It talks about the care with dignity, okay, that she should be getting the proper care during her pregnancy and during her pregnancy, before the pregnancy, after the pregnancy, right? So it's her right. Now, right, one more I would like to mention over here, that is the health care for pregnant and the lactating mother, pregnant and the lactating females, right? So all of these things are the components under the Suman scheme. Basically, many schemes are integrated into this particular scheme, that is the Suman scheme over here, right? Now we shall be talking about one more important scheme, that is the Pradhan Mantri Surakshit Matritva Abhiyan, right? So under this PM Surakshit Matritva Abhiyan or the Pradhan Mantri Surakshit Matritva Abhiyan, we are talking about the screening during the antenatal care part, right? I told you that minimum 4 ANC should be there, and they are saying that dedicate the 9th of every month to the pregnant woman health. Basically it talks about the pregnant females who are pregnant and about to deliver. So ANC visits, it is actually focusing on the ANC visit, that any female should not miss out on their antenatal care visits, right? So basically they are saying that on every 9th date of every month, right, the female should be coming to the hospital or to some CHC center, okay, for the antenatal care visit over here. So what is the date which you need to remember? That is the 9th of every month to the pregnant health, right? So what are the important salient features over there? Let's just talk about them briefly. Antenatal checkup for the pregnant woman in the 2nd or the 3rd trimester, very, very important, right? Improve the quality of the care during the antenatal visits. Appropriate birth planning and the complications will be explained to the mother over there. Identification and the line listing of high risk pregnancies based on the medical history. If there is some high risk pregnancies and if the woman is coming to the center, right, they might be given the important education, right, and the adequate information to them that they might be needing the transfer to some higher center for their complication purpose, right? And emphasis on the early diagnosis, appropriate management of the woman with the malnutrition, right? Or if they are having some kind of chances of infection or transmission of the infection from the mother to the female, if some mother is diabetic, if some mother is hypertensive already, right, all of these things might be handled. If the mother will be coming for the antenatal visit, only then we will be able to know that this mother is having some kind of problem, right? And then we shall be able to treat it. So early coming, right? So basically the purpose is that the females should be coming to us earlier, so that we shall be finding the disease earlier and we shall be diagnosing the disease earlier, and we might be treating the disease earlier, right? So earlier we will be diagnosing it, earlier we might be able to treat that as well, right? And earlier and we might be able to reduce the chances of the morbidities in the mother also and in the upcoming baby as well, right? Okay, so these are the important aspects of the PM Surakshit Matritva Abhiyan, and basically just remember the date also, 9th of every month. The government of India promoting the females for their antenatal visit checkups, right? Okay, one more thing, guys, it involves a screening in the ANC for high risk pregnancy. Okay, so it involves screening, right, for high risk pregnancy, right? Because if they will be coming for the ANC visits, so particularly chances will be increasing for us to find out the high risk pregnancy, right? For example, it could be the ectopic pregnancy, it could be the pregnancy induced hypertension, and all of those things. There are many things which you must have studied in the obs-gynae classes as well, right? Okay, now according to this particular scheme, it classifies the pregnancies into different categories. So what could be the classification which we shall talk about over here, right? So we are tagging them particularly. So classification, if I talk about, on one side we shall be talking about the categories, and on other side we shall be talking about the color code which we are giving to them, right? For an example, we shall talk about if there is no risk factor, then it is very good thing. If it is no risk factor, we will be giving them green sheet. So in this case, we will be calling that this is the green category, right? So we will be providing the green sticker to them. Okay. Then if let's say that is high risk pregnancy, let's say there is high risk pregnancy, then we will be giving which card now, which will be giving which sticker now? Then obviously we will be giving the red sticker. This is the red category for us, right? This is the red category for us, and that's how they need the special attention. They might be needing the special care. Now then if you talk about, let's say there are some comorbidities like they might be having the diabetes, they might be having the hypertension, they might be having the hypothyroidism, and they might be having so many of things like that. So if these kind of comorbidities are present, we will be providing yellow sticker. We will be providing the yellow sticker to them, right? And at last, if there is pregnancy induced hypertension, right? This is the special area which we are mentioning over here, and they will be giving the blue sticker. Okay. So according to this Pradhan Mantri Matritva, right? Pradhan Mantri Surakshit Matritva Abhiyan, according to this particular scheme, we shall be categorizing the females antenatal by the help of antenatal visits or antenatal checkups. By the help of that, we shall be categorizing the females in these 4 categories. That is the no risk factor, that is the green sticker, high risk pregnancy, red sticker, comorbidity, yellow sticker, and the special one there is pregnancy induced hypertension. For that we are giving the blue sticker, right? After that we shall be talking about one more scheme, that is the Pradhan Mantri Matru Vandana Yojana, right? So what is that? PMMVY, that is the Pradhan Mantri Matru Vandana Yojana. This is the logo which you need to remember for this one, Pradhan Mantri Matru Vandana Yojana, right? So here what we are talking about, here we shall be talking about the care of, it is talking about the care of for first child of their family. For first child of the family they are talking about, and basically this is the incentive based scheme again. Again there is an incentive from the government of India side, right? And now this incentive will be given, and now this incentive is pretty high as well, right? Okay, in the previous schemes I have told you about the incentive of rupee 1200 on the rural areas and the 600 in the urban areas and like that. Along with that, ASHA will also be getting, ASHA worker will also be getting the incentive. But here we are talking about much bigger incentive. That is up to 5,000 rupees one female shall be getting under this particular scheme, right? So this is the scheme which you need to remember definitely. That is the Pradhan Mantri Matru Vandana Yojana scheme, right? So here we are talking about for the care of first child of the family basically, and this is the centrally sponsored scheme, right? Centrally sponsored scheme. So here it will be the female shall be getting the incentive from the central government of India, right? So here the incentives are actually given to the females, right? But here the incentives will be given to the female in the installments. There will be the first installment, second installment, third installment, like that, like the EMI you can say, right? So here the first installment of rupee 1000 will be given, right? Now there are some conditions, right? There are some conditions. For an example, some females are there, right? Let's say there are thousands of females, right? Now they are eligible. Are they eligible? Yes, they are eligible, right? Now look how they might be not eligible further. Let's talk about that. First installment will be given to those females of rupee 1000, which will be of rupee 1000, who will be getting the early registration through their ANC visits, right? When I was talking about the antenatal care visits, guys, I told you that whenever they are getting the pregnancy, before 12 weeks they should be registering it, right? Before 12 weeks or as soon as possible. So here on early registration of the pregnancy at Anganwadi center or at approved health facility, if they will be registering them as soon as possible or lesser than 12 weeks, right? That is the importance of ANC visit. If they have registered, they get their 1000 rupees. Done, right? Second one. Now second installment is much bigger. That is the 2000 rupees, right? That is the 2000 rupees, right? If they want to get this 2000 rupees now, now there could be some females who have not registered. So they are already out of this scheme. Now there will be the scheme, let's say 800 females are there out of 1000 females, 1000 pregnant females. 800 females have registered them, right, under this scheme. That is less than 12 weeks they have registered, right, to some center or to some hospital. Now they will be getting 1000 rupees. Now let's say out of those 800, who will be getting the 2000 rupees? Look, they will be dispersed after 6 months, right? They will be dispersed after 6 months of pregnancy on receiving at least one antenatal care checkup. So after that first antenatal care checkup, if they will be getting the second checkup done, right? And their subsequent checkup done, after the 6 months of that, they will be getting another incentive, that is second incentive from the government of India side, right? Now again, some female will not be going for the antenatal care checkup due to various kind of problems, social problems and their own personal problems, and all many kind of problems might be there. Okay, so that is the thing. Now after that, the third installment comes, and that is also having the 2000 rupees. That is also containing the 2000 rupees over here. Now here, after the birth of the child gets registered and child has received the first cycle of immunization for BCG, OPV, DPT and hepatitis B. In the immunization, we will be talking about these kind of vaccines that at birth, at 6, 8, 14 weeks, 16 to 24 months and several years, how we are giving the which vaccines we are giving. We will be discussing about that in the immunization chapter, right? So please refer to that chapter if you want to get the details about these vaccines, right? So after the birth of the child gets registered, okay, so now the child got the delivery. This delivery should be happening inside the institutional, first of all. Secondly, after that, obviously the immunization should be happening. As far as newborn is concerned, they must be getting the immunized, right? So they should have received the first cycle of immunization for BCG, OPV, DPT and hepatitis B. If they have done so, then they will be eligible to get this third installment of 2000 rupees under this particular scheme, that is the PM Pradhan Mantri Matru Vandana Yojana. So very important guys for us, three installments they are getting. 1000 first installment is 1000, then 2000, 2000. That's how this incentive has been distributed to the females, right? And now we shall be talking about one more scheme, that is the LaQshya program, right? LaQshya program, you shall remember the logo over here. We have already talked about the logo once. This is the LaQshya program. Under this LaQshya program, what we are talking about under this LaQshya program? Under this LaQshya program, we are talking about to improve the quality of the labor room, care, right? So, and the maternity operation theatres, right? So, for the normal vaginal delivery, we are keeping the woman in the labor room. For the C-section delivery, obviously, if we will be needing a C-section, then we need to shift this patient to the OT, right? So, there the conditions must be suitable for them, right? So, we need to improve the quality over there. That is the LaQshya program. That is one of the component of the LaQshya program. We want to reduce the preventable maternal and the newborn mortality. So, preventing the newborn and maternal morbidity, mortality, and the stillbirth, we want to reduce them, right? So that is the thing. Benefit every pregnant woman and newborn which are delivering in the public health institution. So through several schemes, we know that through the Suman scheme and through several schemes, Janani Suraksha Karyakram and all of these things, we have talked about the incentives which we are giving if they are getting their deliveries inside the hospital basis, inside the institutions, then we are providing the incentives to them, right? And we need to make sure that they are getting this under this LaQshya program. Till date 24-27, we are actually looking for public health facilities across country have been identified, right? So that is the thing over here, right, which we shall talk about in this program. So till date 24-27 public health facilities across countries have been identified, right? Now as I'm recording this video, this number must have been increased now, right? So this is the thing about the LaQshya program, right? So under this in this particular session, we have talked about so many important things, and 2 to 3 MCQs might be asked from this particular chapter. So it is very high heat chapter guys. Please go through it at least 2 times so that you will be able to solve the MCQs nicely, right? Thank you so much for joining this one. I will be seeing you in the next one. Thank you.